Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, Chiro Health USA, ChiroScript AI, Chiro Moguls, the Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle.
Hey guys, welcome to episode 643 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we had the opportunity of interviewing Dr. Patrick Garrett. And if you want to hear a story about no competition in medical care, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle podcast. Today I have Dr. Patrick Garrett on with me. I'm really stoked to have this guy on. The message that we were just behind the scenes talking about is going to make people think about an actual big idea. I know the premise of chiropractic was focused on something called the big idea. Well, I think in 2024, we have a new big idea, and we're going to reveal some of this to you, but there's no competition in medical care. So we're going to pull that anchor down, and chronic healthcare management is not the ideal scene for the profession or for the patient. We're going to talk about biodiversity when it comes to the chiropractic playing field and who's out there and how people can actually get people better faster. But before we jump into Dr. Patrick Garrett's story about how he got into this multi-diverse profession of chiropractic, we're going to tell you our big why. Why do we do what we do over here at Chiro Hustle? Well, first things first is freedom of speech. We know what it's like to be censored and traffic throttled. So we'd never do that to anybody else. So everybody that we've ever interviewed, you can go find their episodes. And I think that's pretty cool. We also believe in medical freedom and family health freedom. They're not the same things, but if you want to know more about those topics, find yourself a chiropractor. They're going to sort you out. We believe in some philosophy over here, and that is the sacred trust. Protect the sacred trust. It's BJ Palmer's last words. If you want to know more about it, check out our show notes. You're going to figure out more about chiropractic than you previously did, I guarantee you. And then we go into more philosophy, subluxation-centered care. We believe in subluxation. We ask anybody that watches this show to please share it with a chiropractic student, share it with your clubs, your groups, because they're taking the chiropractic philosophy out of the schools. So we're going to supplement the profession with Chiro Hustle. So please share the show. And then we believe in what old dad Palmer said is about innate intelligence and universal intelligence, that when you correct the subluxation, it connects man or woman, the physical, to man or woman, the spiritual. I know it's some woo-woo stuff, but that's what chiropractic is. And here we are, number 643 of the Chiro Hustle podcast. Dr. Patrick, welcome.
Hey, glad to be here.
I told you we were going to light some fires today, right?
Yeah.
So tell me about, I'll just share this with people, like back and forth. This guy has a CV as good as I've ever seen from a clinician and a chiropractor. And there must be some big why behind all the certifications and all the postgraduate work. But let's talk about how you got into the profession. I know you said you were adjusting people at 16 years old.
Yeah. I mean, I went to I'm from Fort Worth, Texas, and we had a medical magnet school that like 400 something people applied to, 87% or 87 get in. And I think 16 graduated from the program. And like you take 8 sciences, 5 maths, 4 years of foreign language, 4 years of English, your first 2 years. And so, I'm tutoring calculus my sophomore year, I believe. But then what we did in that program was we're a medical magnet school. So like the last 2 years, all you're doing is medical rounds. And so I want to do chiropractic. So I want to do pediatrician. but I did my internship and preceptorship at Cook's Children's Hospital, and kids died, and I was not cool with that part at all. So then I started looking for a profession that had high satisfaction, and your patients don't typically die, right? And so I considered chiropractic. I really liked that idea. Had high satisfaction, and again, you help people not die and have better, higher quality of life. So we didn't have a chiropractic preceptorship, so I went and did my rounds at Texas College of Osteopathic Medicine. And literally at 16, I'm sitting there with all the college students learning to diagnose, prognose, and treat musculoskeletal conditions, which was pretty amazing. And so I was adjusting people's moms, students at school. Like I literally could not hug anybody without like feeling their back tension, and segments that are out. And then I graduated early. So 3 of us graduated early, Hong, and then my friend Nam, who went to Harvard Medical School. And then I went to Cleveland University, or Cleveland Chiropractic College back then. And I graduated that early, but I still felt like I was kind of hogtied a little bit about what I could do. And I honestly kind of felt like you can't just eat crap and get adjusted. You can't have poor posture and get adjusted. Like I feel like there's a little bit more that I'm missing. And I always want to know every way that I can fix somebody. So I went to medical school right after, like 2 weeks after I graduated chiropractic college, and then did my 3,500 hours there in all the different clinical things from surgery. Like I got to be the first assistant on numerous surgeries, which was pretty cool. And I gave myself up in the very beginning because they were like, Dr. Gruson was like, act like you're a surgeon. They don't know that you're just a student. And I went in there and scrubbed in, and my glasses were sliding down. I touched my glasses, and one of the nurses yells, "He's not sterile." And so then kind of figured that out pretty quick. But otherwise, the other rounds, man, I loved them, except I got to pediatrics again. And in pediatrics, all we kept doing was medicating and referring out, just like I saw at Cook's Children when I was in high school. And I was like, I don't want to be a part of this. At that time, I had a friend that said he could cure disease, which can't say cure, but and I was like, I don't believe you. Like I've done chiropractic school, I've done medical school, I've done all these rounds, and I haven't quite seen that yet. So I went and took a hiatus from medical school, watched him, asked his patients. And that was the first time that we saw patients, or I saw patients that said, I used to have hypertension, I used to have diabetes, all this. But as I learned, he was really just managing with supplements and treatments. And so that's not fixing like I want to fix. And so then I learned about functional medicine. I got board certified in clinical nutrition several times, in functional medicine, integrative medicine, took coursework at Harvard Medical School in lifestyle medicine. And the Harvard program was the first program that I actually learned how to reverse patients. And they had 2 courses on Crohn's. The first course was your typical course that I took at Harvard. And patient has Crohn's, what medications are we going to give? And then they're not tolerating that medication. So we add this medication, we substitute this medication, and we add these supplements to counteract the B12 deficiency from that medication. And then they still just cut out their bowels and poop in a bag. But Harvard also had their lifestyle medicine program on Crohn's, which was the first coursework I took. And one of my favorite specialties of reversing Crohn's. Gives me so much joy. But that one said patient is causing their Crohn's. What are they doing to cause it? Make these changes, patients 30% better. Make these changes, patients 80% better. Make these changes, patient is cured. But that literally means you can have 2 doctors that go to Harvard Medical School for the continuing education on Crohn's, the same disease. One person poops in a bag for the rest of their life. The other one just gets to live a normal, healthy life. And so we've been doing this. So that's kind of my journey. Like in the first 5 years, I adjusted and kind of learned all this stuff. But after 5 years, like I was just like, I am on fire about healing. And we all have our chiropractic specialists that we send for the chiropractic stuff. But my joy, my authentic like joy is really taking people to know hope and just reversing things they said they could never reverse. And so that's what I've been doing the last 20 years at this point.
Well, I feel like I could take this so many different directions with you at the moment. Um, I guess my biggest, like, I have to ask you this because I know that this is common within the chiropractic profession because I hear it a lot and I get that part of it. But how many times do people come into you and say, why didn't anybody else tell me about this?
Right. Well, what's funny is like, okay, so we have patients all around the world, which is insane because I'm just a Kansas office. But we now have a telehealth one called genomicwellnessgroup.com. So we have, since COVID, so many telehealth patients from around the world, around the country, we just kind of like created a new system for that. But I'd have a patient that come in, like nobody sees me first. They're always, what's the new drug? What's the new supplement? What's the new lab test? Let me make an appointment in Mayo. And then eventually they're like, what's that dude's name again? So our typical patient that we have, like they've had up to 7 referrals before they actually came in. And so like, all right.
Don't we see a problem with that as like a culture? Don't we see a huge problem with they had to go see 7 different people to crack the code on their dysfunction of life in order
Right.
for them to before they find somebody like you?
Right. No, that's crazy. And it's crazy it's not the standard. So
It
like,
almost makes me want to flip the table and kick shit.
right.
Like,
You
what
know,
are we doing here?
well, yeah. Well, the goal is not really fixing people in most healthcare. It is management in healthcare. Management is where the money is. Management is where we drive our profession. So simple is how you cure, complexity is how you sell stuff. But we had a patient one time that came in and he said, I've been referred, or no. He said, if people learn about you, they're going to be on fire. They're going to be making all these appointments. You're going to be just insanely filled up. And I was like, well, who referred you? And he's like, 7 different people over 3 years. Like, yeah, this should be the primary place you start so you don't waste all your money and time and energy, and all your savings account. But it's not. Nobody wants to really make the hard choices, and nobody knows what the hell I do in the first place. So we have a handful of chiropractic offices and a few gastroenterology offices that really get most of our local kind of referrals. So when chiropractors have things they can't fix, they send them to me to reverse their Crohn's, ulcerative colitis, eczema, anxiety, depression, those things. So that way it's within our profession.
So is that what you were talking about earlier off camera when you're talking about the biodiversity within the profession?
Yeah.
Explain that to people a little bit. Like how does that look for, like, say I send you somebody that I realize isn't getting better with a nasty case of radiculopathy in their arms and hands?
Yeah. So, on the other side, just know when patients are like, man, I've been having neck pain, back pain, paresthesia, I'm just like, you should see a chiropractor. I have a handful you need to go to. Like, I love that, but that's not my joy at this point. But yeah, so if a chiropractor has a patient, say like with Crohn's, and they can't fix it with adjusting or with supplements, then they send them to me, and then we systematically go through and say, why do you have this? Because most all autoimmune is very simple. It's it's T cell dysregulation, secondary molecular mimicry. In research that's well published for the last 20 years, but there's no supplement or medication for that. You have to literally know the physiology of how the body works, how we mess it up, and then teach that patient to reverse it. Then they don't have to worry about all the other chiropractic kind of like comorbidities, especially like you think of like we have a lot of patients that come from therapists. If someone has anxiety and they have IBS, yeah, they think they're going to crap their pants all the time. That's going to make it really hard to fix that person mentally, right? But once they get rid of the IBS, now all the talk therapy, cognitive behavioral, the dialectical behavioral therapy will have a way more effectiveness for that patient than them trying to, kind of talk their way or cognitive their way out of thinking they're going to poop their pants all the time. Same with chiropractic patients. I don't know how many you adjust with a lumbar roll that aren't farting, but if they have IBS, they're going to be very apprehensive about getting adjusted in certain ways.
Mm-hmm.
that answer your question? That's
it does. It takes me on a journey to I guess ask more questions that
yeah.
are based in your wheelhouse. And I know that one of those is epigenetics. So I'm really curious how that links into, I guess, the modification for somebody to find what I guess the medical world calls it homeostasis.
Yeah, cancer, just like any disease is really just in a normal expected outcome. And so reestablishing normal is the cure. And we live in a society where a long time ago we were at 1 in 8,000 for cancer, to the World Health Organization predicting that everybody in America born after 2010 will get cancer at a rate of 100%. Studies where they've taken traumatic deaths, from motor vehicle accidents, fires, that kind of stuff, and they checked them, scanned them for cancer, and 100% had cancer. So cancer is this normal expected outcome as you mutate DNA through things like benzene and gout medicine, x-rays. But benzene is your styrofoam. It's your BPA plastic that lines all your toxic aluminum cans. So you can be drinking Perrier and you're literally drinking from a can that's lined with a plastic from benzene, which my textbook in 1934, Anemia in Clinical Practice, says benzene causes leukemia, lymphoma, and cancer. And then we're like, why don't we drink out of styrofoam cups and get some cancer? Why don't we drink out of like even cheap Chinese metal tumblers, which are BPA free, but it's really BPS. It's just a different styrene. Or the instead of cotton, we'll all wear a non-wrinkle polyester. Well, that's petroleum. I don't want to buy leather, so I buy vinyl. Now you're sitting and sweating on a couch with petroleum. So we eat like sodium benzoate, even oxybenzone that we put on our skin. Like we literally eat, drink, breathe, and rub things that cause cancer on our bodies every single day, all day. And then we don't eat very basic foods like fruits and vegetables that reverse DNA. So the minute that your mutations are greater than your ability to fix, that's a sustainable mutation. The minute that you stop poisoning the body and eat to reverse disease, reverse cancer, then epigenetically it goes back to normal. And then you don't have sustainable cancers, which is why the cure for most all our problems in America is get a plane ticket and get the hell out of here. It's not perfect, but they do a far better job than we do at this stuff. I mean, most of our foods are banned in other countries. And if you look at something like, okay, so like epigenetics is the complication of this, right? If you go to Subway, they had 3 court cases. One, the DNA of the chicken was only 50% in their chicken sandwich. The tuna, in another lawsuit, they did a DNA test for tuna and it's 0 DNA for tuna. And then the court had a third trial where they said that their bread should not be considered bread. Like if you look at Gatorade, the color's petroleum, the flavor's petroleum, the smell's petroleum, the container is petroleum. If you look at gum, to take gum, the color's coal tar, the flavor's coal tar, the smell is coal tar. And I shit you not, the preservative is paint thinner, toluene, and the 3 sugars are formaldehyde. How long can you consume this stuff before you create more genetic mutations than you can actually repair with your diet? So, even though like my degree set is, it's in genetics, I had to go to University of Melbourne School of Medicine to actually take all their epigenetic courses, right? And now we have NIH grant funded study that I'm part of at KU Medical School on proteogenomic psychiatry, looking at hard to treat patients from these genetic mutations that are caused by what we actually do.
Well, do you think any of this has to do with genetically modified food?
Well, somewhat, yeah. I mean, genetically modified, so, you take some DNA from a salmon, put it in a corn plant, shake the dice, see if that hybrids out into some, sustainable plant. That's a whole Frankenstein experiment on its own. But the whole purpose we do that GMO is So we can spray a chemical on there that kills every living thing except for that species. So you're part of that. I mean, one of the craziest things that I learned in embryology was we do not have human DNA. We have everything DNA. Only tardigrades and amphibians make more DNA than humans. But your 6 foot of DNA in every single cell makes chickens and frogs and goats and salamanders. In fact, if you remember back to school, everybody looked like a pinky, like a shrimp. Like every single species, for the most part, looks like a shrimp. We all have a giant tail, we have web fingers and toes, and we have gills on our neck and some weird morphic kind of head. But that means any chemical like glyphosate that disrupts the genetics of any other species has the potential to disrupt our species. And there's a price we pay for this. So when you look at someone's lawn and you're just like, oh my God, they have like the most beautiful lawn ever. I'm so jealous. It's because they sprayed a chemical that kills every living thing except for that seed. And then the kids are playing on that, the dog's rolling on it. And I'm all driving by going, nice yard. When you guys get cancer, you should call me. So that part, the glyphosate, is the epigenetic mutator that then leads to oncogenes being turned on or mutated, and then our apoptosis genes being actually mutated to where you get a sustainable cancer from that. Now,
so did you ship people out of America to get them better?
No, my goal is, I'm always like, look, your body's genetically designed to heal. You're physiologically designed to heal. Literally every disease is, I just rub my arm with a pin until it hurts, and I call it pin rubbing skin disease. And they give me analgesics, and then I do natural analgesics for the rest of my life, and then it gets infected, and then I take antibiotics, and then I take natural antibiotics, and then I get resistant to those, and then I have no more antibiotics, and then they do a MAB drug to shut my immune system off, and then I die of a toenail infection. But literally every disease is, what if you just stop doing that thing? If you do nothing to the body, it genetically will heal, physiological, it'll heal, right? But we also, so we're designed to heal given the right opportunity, but we also live in the sickest, fattest, dumbest population with the most anxiety and depression in the world, where 3 out of 4 people chronically manage chronic conditions until they die prematurely. We are not the space in healthcare where we are like, here's how you heal the body, or stop poisoning yourself to cause these problems, whether it's diabetes type 2, 3, 4, or whether it's epigenetic mutations. We have to stop causing these things while we live in America.
I saw that. I was reading through your bio and extensive education, and there was something on there, genetic mutation in the MTHFR, and I've heard some people talking about this, specifically Gary Brecka talking about this with 10X Health. How do you help with that?
So the first thing is, you always, now they have these lab companies that sell labs to patients to find 1 mutation or maybe 5 mutations. Psychogenic tests now, they do like 20 different maybe genes. But you literally have 20 to 25,000 genes in your body, right? Now I have close to 25. I'm not bragging about that. But yeah, my DNA is bigger than most people's. Now, whoops. It's just been here. Okay. There, sorry. So one of the mutations is that methyl tetrahydrofolate, right? So that's our NIH grant funded study for hard to treat patients through KU Medical School. And within that, if you just test that one gene or just a couple of those methyl genes, that doesn't tell you the whole story. So honestly, the best thing you can ever do if you're going to do epigenetics is have them do a 23andMe, and then you download that raw data, all 25,000 genes, into promethease.com. And it costs $12 every time you do it. I think it's through Stanford. Stanford used to have a course on it for docs. But that'll let you see the whole entire genome of that body. And so I think it's 88 mutations. Like when we were doing our grant study and our research kind of validation for this, like most docs don't care about all that stuff. they don't care about the MTHRR or the MTHFR. I mean, they just care about C677T, or if it's a TT, homozygous mutation from mom and dad, or like a 1298 AC. But there's a lot of other information going on there that sometimes differs how you'd actually treat it. So like we were talking about before, pretty much everybody in our profession and my profession, as far as like natural medicine, functional medicine, lifestyle medicine, is taught by someone who's sponsored by a lab company or a supplement company. And so then it becomes, you should do this expensive lab that only tests like a handful of things, as opposed to knowing the whole entire genome in your body and all 200 to 300 mutations that most people have that we typically see. So when we do that, we can look at every different gene in there. And if it's one mutation, like from mom or dad, versus from mom and dad, that may or may not make a difference. So I have that mutation. I have a 677T mutation. I think it's homozygous, so or heterozygous. It's just one of my parents had it. But you know, with your genome, you have two sets of chromosomes. One's off and one's on, and they are randomly, when they touch, they randomly turn on, one or the other. So that's why, you know, I have 4 children that I know about, and I use the same cake batter with the same woman to make these 4 kids, and they all look totally different, except for the twins. They look the same. Now, they look like my neighbor, but they look the same. So the reason you can create all these different kids that look and act differently is because of the random assignment of those 23 chromosomes from mom to dad combinations. Now, if you have a mutation, this is what they don't typically talk about, but DNA is not your destiny. DNA for most people is just predisposition. It is work harder to reverse that mutation or not have those problems, right? There's very few things that are one gene diseases, like trisomy 21 or something like that, where now you have Down syndrome. But that being said, not all, or DNA is not destiny. You can have that mutation, and if it's on the off chromosome, it doesn't affect you at all. So I have that mutation that we study in our research, but I'm not a difficult to treat patient. So it doesn't matter for me. But in our profession, we're like, if you have it, you're super screwed. You got to take these methylfolates, methyl tetrahydrofolate or methylene tetrahydrofolate for the rest of your life. But you don't if it's not an actual problem. If it is a problem, like with the methyl tetrahydrofolate, that regulates that folate pathway and the homocysteine pathway and the bioterapin pathway, which is everything critical to your quality of life. If you have that mutation and you have brain function, memory loss, detoxification problems, sleep problems, mood problems, mood pathway problems, yeah. But if you treat them with the 5-methylene tetrahydrofolate and they snap out all that, then that mutation matters. But if you treat them and it doesn't, then it's probably other lifestyle stuff. I mean, the crazy thing is we've been doing DNA for a long time with our patients. You know, it's kind of hard trying to figure out how to get 25,000 genes and 200 to 300 mutations into a information for the patient that matters and is meaningful. But now it's just like, yeah, things are rarely actually genetic. They're genetic predispositions, which is just lifestyle. So rarely, like patient has Crohn's, they're like, oh, I got to get my DNA tested. It's not genetic. Well, I got anxiety. That's not genetic. Like, you know, there's no markers for that in the 25,000 genes that you have. So that being said, that methyl tetrahydrofolate, it will make or break a patient. Like they will be anywhere from schizophrenic to anxious to depressed to having chronic real issues, and nothing works on that patient. That's when it's really important to check that. But if you're going to check it, check the whole DNA. So.
You made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, Chiro Health USA, ChiroScript AI, Chiro Moguls, The Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle. Yeah, there's a lot to understanding the way people get to where they are.
Yeah.
And there's a long history behind people before they show up to you.
Right. Yeah. And that being said, it is still easy as hell to reverse pretty much all conditions and find normal. Like our goal is, people come in for one or two things. We do a comprehensive intake, which is like, tell me everything you eat, drink, pee, poop, sleep, from head to toe, every single thing that's falling apart. So then we go through that and we create a list of every clinical problem that patient has from head to toe. And that list is usually like 30 to 60 to 90 things on average. Most people have one or two things that they're dealing with, but I don't know if we have time for this. This is my favorite kind of example is people do what's called Skinner boxing. So this is how they end up where they are. And so, do you know what Skinner boxing is?
Nope. You're teaching me something new.
I made it up, but it's from Dr. Skinner's work back in the 1960s that explains almost every patient that comes in, every person that we actually know. And they did this experiment where they took this dog, they took this room, divided the floor into two sides. Floor A was electrified with a switch A. Floor B was electrified with a switch B. And then they put a dog in there, because we're kind people, right? Now, if they turn on floor A, anywhere on this half of the room, the dog is painfully shocked. But if he goes over to here, where does he go? So with that, he will run around that room until he's on the off floor, right?
Sure. We all would.
So our philosophy of that is when we believe happiness is a choice, we tend to choose happiness. Now, not everybody will, but most people walk 5 feet to be out of pain. Now, if the dog, is it this way? If the dog's over here and they shut off floor A, now they turn on floor B. Anywhere now on this half of the room the dog's at, it's painfully shocked. But if he runs back over to floor A, it's off. Where does he go? So no trick. So he'd just run around the room until he's out of pain. So he'll go back. So like even stuff that didn't work for us, if it works now, we're totally cool with it. But the key of this is what if they just turn on both now and leave both sides of these floors constantly shocking that dog all day, every day, and the most miraculous thing happens. It just becomes normal. So the observers watching that dog during the research can't tell whether the floors are on or off as it eats and sleeps and sits because it's so used to feeling so awful all day, every day. But that's where we see people in public. We're just like, hey, Mary, how's it going? And they're like, oh, I'm doing pretty good. I got the monthly migraines and I guess I still have daily headaches. And I can't function without a pot of coffee these days. And I don't think I pooped in 3 days. And my anxiety brain fog's out of control. But overall, girl, I'm actually feeling pretty good. Those are Americans now. We just Skinner box until we are just used to feeling awful, until that one thing becomes greater than the pain of change. And then we're motivated to be like, look, I can't deal with, this eczema anymore or migraines or whatever it is. So that's the hard part is you have this whole clinical picture of going on where people even go to the chiropractor and they're just like, I just go in here for that one thing, but they're a giant nightmare behind that nobody's asking.
And also the profession says, I only do this one thing and I'm going to do it really well. Yeah. And if you have anything else to talk to me about, I'm just going to focus on this one thing. And you can have all these thoughts and feelings and ideas and you can share them with me, but I'm just going to focus on this one thing. And that's really the dogmatic approach to the profession of chiropractic, which I think it's important to expose that to the world too, is to say, look, if you go to a chiropractor and they're like strictly a chiropractor, they're going to do what they do best. They're going to use their toolkit to use their abilities to correct you with what they think is their skill set and art.
Yeah.
And that's a beautiful thing. But a lot of these people come in there with like oversized like storage bins full of conditions.
Yes.
And they have basements full of conditions and attics full of conditions and abandoned cars in their yards full of conditions. And they have the empty lot next to them full of conditions. And like they have like this abomination of condition, but they think that the chiropractor is going to be their last ditch effort and they're going to magically give them this miracle adjustment and all else is like fine tuned and life is better. And they sit through a chiropractor's lay lecture and they tell them how conception happens and how two cells come together and we get a child like you did earlier. It looks like some type of like sea monkey. And the next thing you know, that person grows up into this human with these spinal cord with the interventions to the nerves going into the organ system, conducting biomechanics. And when we get postural deviations, biomechanics shut down. When we get postural deviations, organ systems stop functioning the way they're supposed to. So biomechanically, the chiropractor's like, look, I'm just going to focus on this thing. I'm going to check, detect, and correct a vertebral subluxation and keep your storage of all this bullshit that you have with you for someone else. Because you didn't trust me 7 doctors ago and you went and saw 7 other people before you got to me. And now you expect me to have this miracle adjustment and I'm not going to really listen to you because I only do one thing. I do it really well. So just face down on the table and high five me and I'll see you next time.
Yeah. And, you know, that's a good point. Like there was a study that came out in JAMA, British Medical Journal, New England Journal of Medicine, quite a bit ago, but it made the papers because it said 52% of all diagnosis and treatment within medicine is a failure or a misdiagnosis, which was like, you're better off flipping a coin. And so when they asked the author of the study, it was Washington School of Medicine did the research, and they said, you know, we're not trained to be primary care doctors. We are trained to be emergency doctors. Everything is top 3. Through all my medical rounds, it was top 3. Well, what if it's the 4th thing? Well, you don't get that option. What's your top 3? Because the average patient is now interrupted in the first 18 seconds. Within 2 minutes, they have a tentative diagnosis. Within 5 minutes, they're out of the door with a prescription. And you can't do quality care like that. But even with chiropractic, like we have these great docs that are like, you know, kicking ass, like, you know, they do these marketing companies. They're like, how many people can I see in a day? But who's doing the rest of it? If you don't have time to be like, tell me about your diet, tell me about the stress, tell me about, you know, family dynamics, tell me about, you know, the chemicals that you use, any of that stuff. BJ Palmer said you can't medicate a subluxation, but you also can't adjust out the damages of benzene or Cheetos. So they're eating Cheetos all day and eating hot dogs that put you at 9 times greater risk of cancer and leukemia. And you're not going to get adjusted for that. Like there's such a greater perspective of scope within chiropractic that's just fucking being missed.
Well, it's like
because we do this really good and we don't refer out to any of this within our profession.
Well, people don't come in like a puzzle piece anymore. They come in like a box of puzzle pieces that are stuck together with like gum and epoxy and lacquers. And they're like, hey, put me back together, doc. And you're like, well, first of all, I have to clean up all the gum off of the puzzle pieces to put them back together. Or I have to take off this lacquer or this epoxy off of these puzzle pieces so I can put them back together to where they actually function. It looks like a beautiful picture again, or it looks like the picture on the box.
Yeah.
And I think that that's the part that we're missing collectively as a whole medical healing world profession, is that we don't realize how messed up the puzzle pieces are when they come in, and it can only be put together so well. And you're like, well, who put that together? A 5-year-old? And they're like, no, that was like what happened when they went to the doctor. The doctor put the puzzle together and it looks like that, but it looks like the work of a 5-year-old. And you're like, well, who would ever settle for that? That doesn't even make sense.
Yeah.
But what you're saying is they come in with so many multifaceted conditions based on this code. And if you don't figure out where they're coming from, there's no way to shut it off. And there's no way to actually make the adjustment be the actual adjustment that corrects and racks that subluxation back into place. And then the person's like, wow, that was a miracle adjustment. Thank you.
Yeah. Yeah. I mean, yeah, because I've been through that myself. I mean, before I learned all this stuff and made my critical changes, especially the hormonal and the lifestyle and the resiliency stuff, like I was feeling fine. And I would just eventually have so much tension. I'd go get adjusted and I'd wait too long and then it hurt. And then I felt amazing. And that was like, great. But at some point I was like, you know what? I haven't really had all that tension now. Like that's a different way of creating normal to where, again, chiropractors can do their, like, I didn't like the part of chiropractic of where I felt like I was their ibuprofen. I did not like that part at all. It's like, you need to make these changes. They don't make those changes. And they're back in. I just keep seeing the same people for the same thing. And that's, patients have to be responsible for their health, but we also have to look at that big picture, which is time consuming for them.
Mm-hmm. Yeah. I just go back to the same analogy. You buy a jigsaw puzzle and you take it home with your family. You're going to put it together. And then you finish it, it's on the table and you look at it and you're like, gosh, that looks like a 5-year-old put it together. And I think that that's really what's happening in our medical arena is if you had to like guess like who was behind that person, you'd be like that. There's no way that person's board certified. There's no way that person's 45 years old. You'd be like, that person might be 12 years old that did what they did to get this person better. And that's just the disbelief world that I live in right now. When I see so many people chronically ill, like I bet if I made a post tomorrow, like who raise your hand, who eats a meal and wants to take a nap immediately.
Right. Yeah.
Like who like gets more than 6 hours of uninterrupted sleep a night. Raise your hand. Like, I bet you like it would be cricket post. Like people aren't sleeping well. And they're medically not conditioned to use the fuel that they're eating for like actual energy. The things that they're eating is causing internal inflammation, which is leading into these things that you're talking about, IBS and Crohn's, and they're feeding themselves sick. And they're like, hey, who's the doctor that's going to fix me? I'm going to go to 7 of them and we're going to flip a coin. And maybe by number 8, I'll find the right fit. And by the way, they all spent 5 minutes with me and just follows that same play that you just told me. They get a diagnosis and a prescription by minute 3, and then by minute 5, they're out and they never get touched. And I think that that's the real takeaway for me about this beautiful profession of chiropractic is it's a touching, healing art. And most of these people that come into a chiropractor have never been examined orthopedically. They've never had x-rays taken of their spine. They've never been explained to them what the nervous system does. And they've never had anybody put their hands on them and actually adjust them and actually listen to them and make an objective reasoning why they're doing what they're doing and tell them. So I think there is something to the whole thing about how you've married in your expertise and with the chiropractic profession being a chiropractor. But I also think that the reason that people do get those miraculous, like cavitations and like, wow, my life's changed. Yeah. It's because chiropractic just touches people differently. Yeah. And it's not a part of I've always held this line. It's not a part of the medical arena. Chiropractic is chiropractic is chiropractic. The reason that the medical arena tried to adopt chiropractic because it actually got people better. And the reason that they stole all of the identity of chiropractic is because it actually got people better. The reason they extrapolated all of the wellness ideas and all the maintenance ideas was because it actually got people better. So the medical world has been piece by piece, like saying, hey, this works for chiropractic. Let's turn this into the medical jargon too. So people are really confused when they hear like a pharmacy delivers wellness to them and a chiropractor's like, no, we'll just get you on a wellness plan. Yeah. So I think that chiropractic has done such a dynamic job of like adding life and value into people that the medical world saw that and they knew that their ship was sinking. They're like, hey, let's start stealing all the chiropractic vernacular and start implementing that into our model too. Whereas the chiropractors are like, well, we came up with this and we created philosophy on this. We created techniques on this. We created our science on this. And now you want to use our stuff, but you've been trying to bury us for years.
Right.
So
well, I got a great story for you then. So like when I was in family practice rounds, my mentor was a DO, and they were the magna cum laude, right, of their class. And so we had a patient. She's like, go see these patients and then report back to me. And then we basically talk through it. So the patient, she said she was in the garden. She was reaching for something and felt a pop in her back.
Fucking
and
Harvey
like,
Lillard.
I can't turn like that anymore. And she said, it feels like something's out. And so I present the patient to my mentor, and she goes, well, what do you think we should do? And I said, I think you're a DO. I think you should adjust that spine back into place so that she could move again and be out of pain. And she's like, well, I didn't really like that class. What else could we do? Well, we can give her Biox, which later got banned because it caused 150,000 heart attacks during clinical trials that they forgot to report to the FDA. And then when that doesn't work, we can give her something else. But like, that was the like quintessential, like, oh my God, like you won't touch the patient. Like that's like you just push here really hard, and then they would pop and they would be back in range of motion. And like you could literally cure this patient, and you're like, I don't want to touch a person. Like touch the person, like physically move them. And that's why I tell patients all the time, like, you need to go see a chiropractor. Nobody's going to move that. They're going to look at it, examine it, and give you something. But there's only one profession that's really going to actually fix that problem by hand, touching you.
And love what they do.
Yeah, yeah.
And love what they do. And talk from the mountaintops about why they love the profession and why they love you in their office and why they want you to get your kids checked and then why they want you under care from the next breath to the last breath. And they want you to like tell everybody about and refer in, because they want everybody to understand that chiropractic works. And they want people to understand that you don't have to go take every pill, potion, and lotion in order to try to feel better in this physical earth that we live on. Like there is a thing when the nerve does have a dysfunction in it and it's stretched or strained or pushed tension onto it, and you take the tension off that nerve, it's like the garden hose, you took your foot off of it and all of a sudden you have water again.
Yeah.
So it's very simple for people to understand. But when it comes to a professional like referral system, like you're talking about early on, the first minute, biodiversity, we have to become better at creating bedmates or bedfellows within the profession to say, look, I get it. You're better at me than I am at this. So you take care of these people and we'll make it about the patient and not the money now.
Yeah.
And I think that when we get to that paradigm, those kids that you said born after 2010, they have a better fighting chance of really having full body health and not getting those cancers.
Well, are you Gen X?
I am.
I'll be 46. Full generation? All right.
Yeah.
You know, our generation is the first one to not outlive our parents, that we're supposed to lose 28 years off our lifespan. So we're supposed to die. Our generation is supposed to die in our 50s and 60s instead of 70s and 80s. But those millennials and Gen Zs, those kids are dying from Red Bull. You couldn't kill a Gen Xer with Red Bull, right? But they are so malnourished and so toxic. And that's where even like you mentioned money, like affording care, we save patients an average of $6,000 to $25,000 per year to no longer chronically manage that condition. Like all that money, now they can pay for wellness care for the first time instead of goddamn medications and freaking surgeries and hospitalizations. Like we are destroying wealth, generational wealth through chronic management of chronic disease. So especially for chiropractors, like referring in for reversal kind of things, man, all that money they can now afford. Like, yes, let's see you, for wellness care because I can afford it because I feel good now and I want to stay feeling good, as opposed to just kind of tweaking them by as they basically go bankrupt.
Well, brother, I love you. There's probably 7 more topics here on this piece of paper I could have talked to you about. I really appreciate you making time today to be on 643 of the Chiro Hustle podcast. I wish I could talk to you for another hour. I have so many more questions about miracle cases that you get coming in, but I'll definitely bring you back on if you'd like to, and we'll go for part 2. And we'll go a bit more deep dive on miracle cases that you've seen coming through your type of care pattern that you deliver to people, and we'll talk more about kids, pediatrics, childhood obesity, things like that, and clean eating, and how some of these chronic health conditions can get fixed by just designing our lives around what we feed ourselves better. And I think there's a whole lot more that we have to discuss, but if people wanted to work with you or connect with you or learn more about you, where can we send them to?
So the best place is genomicwellnessgroup.com, and that's where totally now telehealth with that clinic, so that way we kind of help clients from all around the world a little easier.
Genomicwellnessgroup.com.
Yeah.
Cool. GenomicWellnessGroup.com, guys. Check out Dr. Patrick Garrett. This is episode 643. I appreciate you being our guest today.
Man, love you. Love what you're doing.
Yeah, every once in a while I just kick the hornet's nest. I see if they can catch me before I jump in the water.
Yeah.
And with that being said, guys, you guys are just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now. See you, Doc.
Bye-bye.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.